Hello guys, today let's learn about how do you do dating using ultrasound. A very important, commonly encountered doubt in the minds of the residents, and it's quite confusing for all the residents as to how to use this dating and when to use this dating. So first of all, let's try to understand that this dating by ultrasound is only to be done when there is any doubt of the LMP, when she's not sure of her dates or her periods are irregular. That's why taking her menstrual history, her past menstrual cycle before conception becomes very important, because that's when you know that she is not sure of her dates, she was not aware that she was pregnant, and she used to not have regular periods. Maybe a case of PCOS who has conceived and having history of anovulatory irregular cycles. So in many such cases, or during the period of lactational amenorrhea also, they conceive or they have irregular periods during which they conceive and they are not sure of the dates. And at that time, dating becomes very important, and for that we have to follow the ultrasound method to do the dating. So dating by ultrasound, remember that the most important or the most accurate method is the CRL, that is the crown rump length. So dating can be done by her dates, which is important. That is, clinically you are asking the date of her last menstrual period, first day of her last menstrual period. Or the other way to measure is by the ultrasound method, and the most accurate is the crown rump length. This is used to establish or confirm the gestational age. Remember that TVS is a better modality for obtaining the crown rump length. It is measured in the mid-sagittal plane with the embryo or fetus in neutral, non-flexed position, so that you can measure it in a single straight line. You have to take 3 discrete measurements, okay, and take average of those 3. Before 14 weeks, if you are using CRL, it is accurate to within 5 to 7 days. So whatever I'm telling gestational age, it is accurate with the accuracy of just 5 to 7 days discrepancy. So here comes the very important table given by Williams, given in Williams in the 26th edition, where they have told the gestational age that is based on her LMP, and this is the threshold values to redate. That means it's the ultrasound gestational age that should be used if it differs from the LMP derived gestational age by more than the following threshold values. So if the gestational age is less than 9 weeks, you are going to use CRL as the parameter, and if it is more than 5 days, you are going to use ultrasound to do the gestational age estimation. If the gestation is between 9 to 14 weeks, again you are going to use CRL, and if the discrepancy is more than 7 days, then you are going to take the ultrasound acquired gestational age. Similarly, when it comes to 14 to 16 weeks, from then onwards you are going to use the other fetal biometry, that is the BPD, HC, AC, FL, that stands for biparietal diameter, head circumference, abdominal circumference, and femur length. The average of this is calculated by the software which is inbuilt in the ultrasound system, and they give you an average gestational age. Between 14 to 16 weeks, if the difference is more than 7 days, then you are going to take the ultrasound dating. If it is 16 to 22 weeks and the discrepancy is more than 10 days, then you will use ultrasound dating. Then 22 to 28 weeks, more than 14 days. More than 28 weeks, you have to see that if there is a discrepancy of more than 21 days, then you are going to take the ultrasound dating. Remember that the earliest scan is always the best scan for dating. This also, they have shown an image where they are calculating the crown rump length, approximately measuring 7 mm in a 6-week embryo, okay, and this is what they're showing is the fetal heart rate calculated using the M mode. Remember that from 14 weeks we are using the PPD, HC, AC, FL, and as I have already told that these are using these, an estimated gestational age and weight is calculated using the inbuilt equipment software. Before 22 weeks, using the 4 biometric parameters, you can accurately diagnose within a difference of 7 to 10 days, and this is given by the ACOG. If you do the first ultrasound, if the first ultrasound itself is done at or beyond 22 weeks, a very commonly encountered problem, you will have patients who would have come very late, or they were diagnosed with pregnancy very late, and they do their first ultrasound, or the earliest ultrasound will be after 22 weeks, where it is known as suboptimally dated. Okay, because always remember, the earlier the scan, the better is the accuracy. So you can see, as I'm telling you, the as the gestational age is passing by, the discrepancy is increasing. Okay, so if she has done after 22 weeks, it's a suboptimally dated scan as recommended by the ACOG, and in these cases, subsequent ultrasound has to be done in 3 to 4 weeks, and especially in cases when you are seeing that the ultrasound measurements are smaller than expected for the gestational age, and you are expecting, or you are suspecting a FGR. So to rule out or to confirm, you are supposed to repeat an ultrasound again in 3 to 4 weeks. So this is all about the dating using ultrasound. To know about the dating in IVF pregnancy, I will make another video. So I hope it is clear in a nutshell. I advise you to take a screenshot of this. Feel free to write any doubt in the comment section. See you next time.